Hello, welcome to version 2 of SimEMR. This is the electronic medical record used at Alverno College. Please use v2.simemr.com to launch SimEMR version 2. Please use Firefox or Google Chrome as your web browser. Internet Edge or Internet Explorer is not well supported with version 2 of SimEMR. Once you have been given a registration key by your administrator, you will use the register as a new user to create a login username and password. Your username is associated with an email address that you have set up and your password. It is beneficial to you to use the email address associated with your user ID here at Alverno College. It's just a little easier to remember. Once you have placed your username and password into the login screen, click Log In. And if this is your first time, you will see a small tutorial screen that will open. You may choose to watch the tutorial or to go through it or to X out. The screen that will now open is your patient portfolio. Any patient that has been assigned to you will be located on this screen. For this application today, I would like to look at Susie Q's chart. Now there are two ways I can do that. First, I can scan Susie Q's wristband if I am near Susie Q. So if I'm doing a validation or I'm in a simulation, I would definitely scan her wristband by placing my cursor in the scan wristband box, scanning her wristband, then hitting the search icon. I am not near Susie Q and still would like to view her medical record, and so I am going to hit the green Go to Patient located on the right-hand side of the screen. The next screen that will open is the summary of activities. Whether you are at your clinical setting or you're here at Alverno College, always make sure that once you have either scanned a patient's ID band or you have clicked on their medical record, please make sure that it is actually that medical record, that patient's medical record that has opened. I'm going to double check that. I can see Susie Q's name is here, and some of her demographic data is located at the top of the screen. Now this summary of activities is not particularly useful here at Alverno College for our applications. Instead, what you will use is the summary of activities on the left-hand side of the screen located in the dark gray pane. Let's walk you through some of those boxes now. The first box you will see is the admission. Go ahead and click on that, and it will expand to all of her admission information. When you open any of the screens, there will be within there sometimes expandable information. Insurance information is located here, a consent for treatment, and advanced directives. If there was an admission assessment completed by the nurse, it would be located under the Admission tab also. If you are providing the admission assessment, you will need to put in your date and time, which will automatically default when you click on there. You can add new prescriptions, over-the-counter vitamins or supplements, and then expand each one of these and put your information in. Once you have finished, please make sure you hit the green Create button. You do not need to fill in all of these boxes in order to create it. If you forget to hit the green create button though, it will not save your information. So please make sure you hit your green create button to save your information. The next tab is our Provider Documentations tab. When you click on that, it will again expand to open up to consults, histories and physicals, and progress notes. Provider documentation is the same as nurse's notes, just they are done by a provider, such as a nurse practitioner, a physician assistant, an intern, a medical doctor, or a hospitalist. Any consults, physicals, histories will be located under those. The next tab are Provider's Orders. If you were to click on your Provider's Orders tab, what will come up is your Provider's Orders. This screen is not very useful. You would have to scroll through, if there are several orders, many screens in order to look at all of your provider's communication orders. Instead, what you would want to use is the MAR tab, or the Medication Administration Reconciliation. When you click on that, it expands to medication fulfillment, and that is what you'll want to click on. Your Medication Administration Record, or MAR, will open, and you will see all of your patients' orders, whether they are communication orders or medication orders. If I am giving a medication, there are two ways I can chart or document that I gave this medication. Let's quickly walk through that now. What I want to do is, if I am going to give a medication, I would first need to do all of my checks. So if I am giving my patient insulin, I would want to do all 3 checks. 2 of the 3 checks will be done from this screen, where I can see the medication that is ordered, the date and time that it is to be given, the last time it was given, so of course I would not give this medication, as I can see it was given just at 9 o'clock this morning, and she received 10 units. So what I would want to do, if I am giving a different medication, let's say we are going to give our patient a multivitamin tablet, what I would want to do then is do my checks from this screen. If I am now ready to administer my medication and I've done 2 checks, before I do my 3rd check, I will do my 3rd check of the time from this screen, and I will either put my cursor here in the scan barcode box and scan my medication and hit search, or if for some reason my medication will not scan, or I am not using a scanner, then what I would want to do is I will just simply take and hit my green administer button. So here's my multivitamin tablet I am going to give, and I'm going to hit the green administer button because I am not using a scanner. If I was using a scanner, I would definitely scan. I will hit my administer medication, do my 3rd check from this screen, except for the time, as you note, is not here. Place my date and time, how much of the medication I gave, any notes I may want to make, location if it was an IM or sub-Q medication, my initials, and hit save. What will happen at this time is it will go back to the Medication Administration record page, and it will show that I gave this medication. Clinical data is located in the next tab, and this is where you will see vital signs and intake and output. If I want to add vital signs, I will click on the Vital Signs tab here, click on the green Add New Vital Signs note, put in my new vitals, and hit the green Create button. If I simply want to look at vital signs, using the Vital Signs trend is most useful. As you can see, the vital signs will trend for you. You can also see a visual depiction of those vital signs. Nurse's notes will expand to include a SOAP note, head to toe, charting by exception, narrative note, pain assessment, activities of daily living, and the iPass baton. This is likened to the IS bar that we use in our region. Because we use IS bar, I have placed those in the narrative notes. You can open that up, and that is where you will see your IS bar format of charting and can gain a lot of information about your patient. Labs will be located under the Labs tab, and again, you can trend all of those labs. Any imaging will be located under Radiology, or if they have an EKG strip, it would be located there. Also, any other kind of diagnostic strips, say for OB, would be also located. Any surgery information would be located under the Surgery tab, such as their consent for surgery or an operative report. Any discharge records or planning would be located under the Discharge tab. If you are giving any education or are completing a care plan for your patient, it would be located under the Education tab here. This concludes our brief tutorial on the version 2 of SimEMR. If you have any questions or comments, please feel free to get a hold of your simulation coordinator or the faculty member of the course this is associated with. Thank you.